Thank you, Mary, and thank you to ITF for giving us the opportunity to present our work here. Can you hear me okay if I lean comfortably back, or do I have to lean over like that? It's fine. Good. I'm going to split the presentation with Alberto Castro, my colleague here. I want to give you a little bit a background introduction, and Alberto is then going to present the actual, the hard work that went into this. So, yeah, and then we'll wrap it up with a discussion that is, I believe, a little bit more of an outlook towards the bigger issues. I took notice somewhere in the information that there might be a back row of seats that might not be as much of the experts. Just to clarify on the glossary, so when we talk about exposure, what we actually mean by that is cycling. It just sounds much better. And when we call it exposure adjusted, it's basically taking into account the underlying amount of cycling that led to these crashes, just so we square that away once and for all. So on the background, and I apologize that this is probably a little bit on the small side, but this research was mainly funded through the PASTA project. That was a large 4-year European project, 7 cities across Europe. And why I point this out here in this kind of complex framework is just to underscore the point that this type of research is really challenging and complex, and it requires quite large effort. So what we try to do in this project, among many other things, is kind of on the middle to left side, understand cycling as a behavior, which determinants lead people to bike or not to bike. And then, basically in the middle, also the safety incidents that result from cycling. So we're going to talk about that today a little bit. And then the right-hand box is impact assessment, which we improved as part of this, and is a large part of our work, mainly with the heat tool that I'll talk about in a second. Philip laid out the plate perfectly for us. This is basically, if you want, the scientific confirmation of these claims. As part of the PASTA, we conducted a review of health impact assessments of active travel. And what this shows you is basically the bars in the upper half of the graph are the beneficial effects of walking or cycling, mainly through physical activity. And then below the zero line are the negative impacts, mainly from traffic, crash risk, as shown by the literature to date. Of course, we have to take this with a grain of salt, because our methods are much more robust in how we assess the benefits of physical activity than our ability to assess the crash risks in these type of assessments. So the next big piece of background on this work is the health economic assessment tool for walking and cycling, which was the motivation why we did this. This tool has been around for about 10 years, and it basically is a simple calculator that gives you an answer. If you have a volume of cycling, then it tells you how much the benefits resulting from that, or the impacts resulting from that, are worth, well, how high they are and what they're worth in economic terms. It's an online tool that you can access under this link. You need to understand that this targets a non-expert, definitely a non-health expert audience, transport planners that don't need to understand the epidemiologic context behind it. The idea is that it's very simple, and you can run a quick analysis in a few hours. You should have some nice figures on your desk. It's developed by World Health Organization Europe, and so the focus is on European countries first. Follows some basic principles how it should be developed. Mainly we want it to be based on robust scientific evidence. So it's not an innovative cutting edge tool that's at the front of the curve. It's actually kind of like at the back of the curve, if you want, wrapping up what's considered the general consensus. It's an ongoing process. Development is iterative, modular, and we organize these consensus meetings where we invite external experts to agree on next features. And so we just updated the tool in fall, and new compared to the old tool. It now includes 4 main impact pathways. Previously, we only assessed benefits from physical activity and were rightfully criticized for not looking at the risks. And so now it also assesses impacts to cyclists from air pollution and the crash risk that we're going to be talking about today. Before we do that, just a little bit from the researcher's perspective, what is the challenge that we're facing here? And we really think of this as an iceberg type of problem. So it might be more feasible or more obvious to start with fatalities and cycling and maybe national data on the top. But of course, if we go through the rounds here in the room and we all put up our issues, this is a big challenge on so many levels. And if you sort this out in a somewhat cleaner order of things, from a heat perspective, we're tackling this top level or first row of issues. We prioritized cycling for several reasons, only looked at fatalities, and just started with national data. And you can think of your own work and realize how much more there is to delve into. We'll hear about some of these issues today and tomorrow. And then I believe for the policymakers or the implementation side, of course, we would really want to understand a lot about these, what I call risk factors here, but it's basically what affects safety in so many ways at the bottom. And as I indicate there, I believe there's an increase in effort towards the bottom. And we might also want to think about this trade-off between data collection, or what we in this session call documentation of crash risk. We just try to chase everything that's out there, towards the more researchy and modeling approaches when you say, okay, I can't just go into every little village and collect the data. I need to understand a few key determinants that allow me to predict safety risks. And then I'm glad we squared this one away, so I don't have to go into the details, but this is really the key point here. There's hardly, and okay, you can correct me if you disagree, but from an epidemiologist, kind of public health, population level perspective, there's hardly ever a good reason to talk just about absolute crash rates. You really want to consider the exposure that comes with that along to allow for valid comparisons. Impact assessment is basically always a comparison between one alternative and the other. And so that is not flawed. You need this crash rate. It's basically what Philip had in much larger font on his slide. So how does heat look at this? To the left side, you can't read it. You don't have to read it. What explains these crash rates? Risks doesn't care about. Heat doesn't care about it. We just assume your crash risk is a national average at this point. But we do calculate fatality rates in this case that are adjusted for exposure that allow us to then calculate the impact. So how many crashes do we expect from certain changes or differences in cycling? And so with that, I give the word to Alberto, who explains in a little bit more detail how this works in heat.
Thank you, Thomas. Thomas, at the beginning of this presentation, said that this is the hard work. I slightly disagree. I think getting numbers is hard, but even harder is to know what to do with them, and that's why we are here. So I will try to keep very short the explanation about the method and the results we get in our project, and you already received the article. For the heat tool, we had to feed the tool with some background data to be able to estimate the impact of traffic crashes in cycling and walking. And we our approach was to estimate these bike crashes by multiplying a crash risk estimate by the local volume of cycling, which is introduced by the user. So we needed a crash risk estimate as a background data. We built this estimate by ourselves, and since we didn't find any international data set for this crash estimate, we had to do it by ourselves. So firstly, we collected data on fatalities, and we primarily used the data set of the International Transport Forum And only in countries that we didn't have such data, we used the data set of the World Health Organization. The big advantage of the data set of the International Transport Forum was that they had time series, and it enabled that we use average fatalities for 5 years, which reduced the impact of variability of fatalities among years. For exposure data, we used primarily data from national travel surveys, but unfortunately we couldn't get data from all these countries, and for the other countries we had to use to try to estimate this exposure based on the formula you maybe see below, a bit not very sharp, but it's just a multiplication of the mode share by the total trips of all modes, the trip length of active modes and population. And the mode share actually was an assignment of world region mode shares which were extrapolated from city mode shares. So not really very accurate, but the best we had. And we did some assumptions in terms of number of trips and trip length. As you see here, 3 trips per by all modes per person and day, and 4 kilometers per bicycle, and 1 kilometer per by walking, based on existing literature. Based on these different data sources and the different quality of this data, we did a classification of the reliability of the fatality rates that we were estimating. And let's say the killer criterion was the origin of the exposure data. We considered that the estimation based of these world region mode shares was weaker, and that's why it was considered as low reliability. Taking into account this classification, we found fatality rates on a very high or high relativity level in 13 countries for cycling and 11 for walking. You already saw in our article that we presented all the results in a table that shows value, year, data characteristics, and source of fatalities and exposure, and the resulting fatality rate and the reliability level of all countries. And just representing this table in another way, in a scatter plot, and just taking only the very high and high reliable fatality rates, we could see something like this, which shows that we have fatality rates ranging from 0.8 to 5.1. And fatality rates seems to be lower in countries with high cycling volumes. A very similar pattern we found in for cycling, and including in this diagram not only the high and very high, but also the moderate and low reliable fatality rates. We see why we left them and the low reliable fatality rates away from the first diagrams, because we found that they might be inflated in some cases, and they are very grouped due to the assumptions we had to do over the countries and the regional mode shares that we were using to estimate them. And I pass the word finally to Thomas.
Good. So I'll try to wrap this up with a few inputs for discussion. Maybe first, in the much narrower heat perspective, what can we take from this? Clearly, okay, it's a rare effort to have a compilation of international fatality rates that are comparable. So it allows us to run these calculations. We believe we can compare these fatality risks across these 12 European countries that have decent or high quality data. We're more prudent with the rest, obviously, but we still think it's informative to have these quite crude figures next to the benefit figures from physical activity. Why we think we get away with less accuracy in that comparison is because physical activity benefits, as Philip pointed out before, often are a magnitude larger than the crash risk. So it still gives, let's say, local authorities a rough idea of how these things compare. Obvious limitations. What you saw here is very constrained in this heat context. So this simple tool allows us to get away with leaving a lot of details away, including motorized modes. We didn't talk about injuries yet, etc. And we're still at the national level. We did not engage in any harmonization of the travel survey data. It's quite a big topic in many ways. Might have affected some of these figures. And we talked about the low reliability rates. I mean, there obviously the question is the best available good enough? And we would say very much depends on your context. What are you trying to say and compare? And how much detail do you need for that? I think more interestingly, what are the limitations of this beyond heat? We should really be aware of that fatalities or fatality rates don't give us a complete picture. The injuries missing is an obvious one, etc. But I think what I want to point out is really this relationship between high levels of cycling and safety that has been mentioned many times here. So you will see countries that have similar fatality rates, but some achieve much higher levels of cycling. We should really make clear that high levels of cycling in themselves are also an indicator for safety. So that's a bigger safety achievement if you can achieve that rate at a higher level than a country that just sees very little cycling, mainly because it's kind of a self-regulating process. If it's too scary and too dangerous to bike, nobody will bike anymore, and they also won't crash anymore. So there's a bit of a self-regulation going on. I try to throw out a few considerations for a research agenda forward. Maybe first, on a bigger picture scale, I think we have to make sure that we align our research efforts a lot with the policy world and the practice world, and make sure that we really target that. I'm not sure we've done that homework. In heat, this is much easier. We know exactly where we're aiming with that. But obviously, the world is a little larger. This is a big issue, spatial scale. If we restrict ourselves to the national level, it's manageable, it's doable. The data is out there, as you see. It's not easy to find. It's a pain to compile it, but it's there. However, most policy happens at the subnational level. That means these rates or these comparisons will not be as informative. And drilling down to this city level or even project infrastructure level is one of the very big research challenges. I think I mentioned that in the introduction, this balance between data collection and models. Our natural next step is, we want to get city data, we want to get injury data, and it's basically the same recipe to apply, except the effort explodes, right? So at what point do we switch towards model, and then we realize, well, motorized traffic somehow gets away too easy here, so this calls for solid modeling, right? On more specific topics, we really got the feeling that, okay, travel survey standardization is probably too tough to tackle as such a nationally driven battle, if you want. But if you could just publish a basic guide on how to present your data in a publicly accessible website, not only the crash data, but the corresponding exposure data next to it in the categories that we're really interested in, it would make these kind of efforts so much easier. Then for the countries that don't have travel surveys, we need a plan B. And the question is whether these new technologies, smartphones, crowdsourced, web-based surveys will allow for some, supranational solutions where you say, well, it's hard to get it right and representative, etc. But if you have it, you can basically run it worldwide. I've seen attempts to do this based on Google Street View imagery and things like that. So we probably have to get a little more creative there. Motorized modes mentioned many times. I'm sure we'll talk about them. Big issue. Safety in numbers, I call safety in numbers in safety, etc. Going in circles. I really prefer numbers in safety over safety in numbers. It's nice to see it again, confirmation. Yes, the pattern is there. I think we should really leave the term behind as much as possible and aim for the causality. Okay, what explains it? And if we had the data, I will claim here, and hope you could challenge me on this, but I will claim infrastructure or safety improvements were always the driver for these patterns that we saw. And it was never just like, oops, all of a sudden these cyclists appeared and rode in these same old streets, same old traffic patterns. So injuries, an obvious topic. Let's see what else I gave here. Yeah, so in terms of conclusions, probably very much from a researcher perspective, but I think before we rush to, like hard facts that you as a practitioner can turn into concrete, I think we have to do some of our basic homework as a research community, systematically identify needs and gaps, how we prioritize them. I think we need to define roles, what we can expect from certain institutions, from researchers, what is the responsibility of practitioners to advance this dialogue. In many ways, in many pieces of research, I see some needs to really align the methodologies with the objectives that these works pursue. I mean, we all kind of know what we would want to be able to say. I'm not sure we all have the data and the means and the research budgets to do that. And in the end, it really comes down to that we need to produce more robust evidence. I apologize, that is such a cheap and obvious conclusion at the end. But in health research, we would want to see like 10 or 20 really robust, large-scale studies on questions like we're going to ask today before we say, okay, yes, now meta-analysis or something, and we conclude, yes, this is solid evidence. So I'm all for drawing conclusions, but let's not overstretch the little evidence that's out there. Let's not rush into it too much. So with that, I thank you very much for your attention, and I think we'll have discussion then later after Alexander's